Everyone has their comfort level, right? Like, and I would only want a dentist to practice within their own comfort level. And the way to move your comfort level is through repetition. Getting better at at any given procedure. So the way we tackle that is, education and through reps in getting through the more complex procedures. But I really think that you will you will move through them at your own pace. And what I really hope that people get from a pathway course is I call it critical thinking. And for me, critical thinking is it science based? It's got to be based in science and techniques that are proven to work and documented and so forth. Also needs to be grounded in common sense. And common sense is like, is the patient healthy enough for this? Does the patient want to do this? Are you are you skilled enough to have reliable and predictable success in doing that? And when you blend the common sense and the science base around it, you come together with what I call critical thinking, and that is like some people call it problem solving too, right? Like can I solve for this patient's problem and do it reliably and predictably? And if I can, that's where I want to go. And that's one of the skill sets that I think that we try to teach the most is just treatment planning and problem solving for a clinical outcome that is reliable and predictable. Oh, for me, the most rewarding part of my job and teaching is the people and the doctors that we get to touch. These dentists, when someone calls me a mentor, like that isn't like, oh, hey, thank you. No, that's something that like it takes you back a bit because there's a for me there's a burden to that. Like the burden for me is like I want to be the best mentor and best version for them because that means that they see me in a light in to which they bring what my beliefs and what I teach into their own life, and to bring that into to do that is something really special. So for the other mentors and for patients or for attendees to go through the program to call me a mentor, to call me their mentor. Yeah, that's why I do it. I wish everyone knew that Implant Pathway is a safe zone. Like, if you've thought about implementing implants into your practice, like we as we move through decisions like that in our life, like we can make 10 reasons why we shouldn't go. And they could be it's like, oh, it's way out in Arizona, it costs too much. Like, am I good enough? And then it gets down to like, am I good enough to do that? And but I want to do I want to show my skill set to someone else because like are they going to make fun of me? Are they going to think I'm a bad dentist? Or like and what I would hope that people would come to know Pathway as like it's a super safe place to come learn. And the truth is, when we do our introductions at our fast tracks, I ask people to tell me their story, right? Like I want to know their story. Like how did you get here? And not just a pathway, but like how did you become a dentist? And like in 5 minutes, like what's your journey been like? And when they say, I've never done an implant, I'm like, all right, like because this is really my wheelhouse. Now, people will take Pathway and have done, some implants, some maybe even a lot of implants, and they will get something out of this as well. But they've already got listenings of other instructors, other mentors, what they've read and this and that. The doc that shows up completely vulnerable and like open to learning, we serve them the best. Like we absolutely serve them the best because do I teach, maybe newer techniques that are like new on the market? Probably not. Like what I teach is something that I believe is very reliable, very predictable, and very doable when they get back home. And they'll find their own path. Like they'll find their ways to these other things, but I need them to I need them to be safe and be able to go home and do it with confidence. You know, I've seen a lot of our attendees like succeed when they get back to their practice. Like most of them actually, what I would call thrive in implant dentistry, and not every, you know, even when they get back, you know, some people will be like, this might not be for me, but I now know more about implant dentistry than I did before, and it makes them a better referral. You know, like I can tell my surgeon or whoever's placing the implant or restoring it, like I know I can tell them exactly what I want and I can get things back. But um, so many of our doctors go home and they thrive. In lecture, I will tell them, you know, at the very beginning of the day that when they first meet me, I was like, hey, I may ruin some of you for general dentistry, and I'm not going to apologize for it. I'm going to show you another path to procedures in your practice that you may fall in love with, and that may be the only thing that you want to do. And implant is dentistry is one, and uh, I one comes to mind that I probably ruined the worst. Yeah, his name's Tommy Graff, and Tommy Graff took the course and then went home and just started placing implants. And about, I don't know, I'm not sure the timeline, maybe 3 to 6 months after he took the fast track course, he comes back and he takes our all on X course from Dr. Barrett and Dr. Sheth. And about 3 months after he took the all on X course, I remember he gave me a call and he says, "Hey doc, I got something kind of crazy I want to run by you." And I'm just like, "Yeah, like tell me about it." And he's like, "I just want to do implants." And I was like, "Well, that's what I do." I said, "So like, you know, how can I help?" And he said, "Well, I'm thinking about just firing my hygienist and turning my office into an implant only center." And I was like, "Okay." Walk me through your plan. And you know, at the end of the day, I was like, "Man, if that's what you want to do, like, tell me how I can help. Like, let's go do it." Today, he has multiple implant only centers that he's hired multiple pathway grads to be in, and yeah, and there's many more of those success stories out there than that. But I always use Tommy as you know, and talk about moving, like he, you know, not only is a mentor for our regular courses, but he's a mentor for our, you know, more complex courses. And this last symposium, we had him speak, and that was his first time entering the realm of speaking. So like, there's the sky's the limit of what you want to do. And I think that what I love about Pathway is like, if I can help, you know, if I can help accelerate or show people the light of what they might want to do like that, then I succeeded.